Our brain commands our neurological functions, which are mediated by our nerves and allow us to move, speak, see, and interact socially. With over 15 million victims each year, stroke is the first cause of acquired adult disabilities worldwide. A stroke occurs every 2 seconds. A stroke is the sudden disruption of blood supply in the brain after a blockage of an artery or a hemorrhage. Neurons in the stroke area are deprived from oxygen and glucose and start dying within minutes. The neurological functions commanded by the area affected by the stroke are disrupted, leaving stroke patients with motor, cognitive, or sensory deficits depending on the areas of the brain affected. Throughout life, our brain creates new circuits of information when learning new skills or when reacting to a disease or an injury. This process is called neuroplasticity and is also involved in post-stroke recovery. The brain mobilizes existing and newborn neurons to create new circuits aimed at performing the functions previously commanded by the area injured during the stroke. In most cases, this process only allows partial recovery. NeuroAiD is the first treatment for stroke recovery. NeuroAiD stimulates the production of new neurons, increases the number of connections between neurons, makes neurons stronger. As such, it helps patients achieve a fuller recovery by boosting the neuroplasticity processes. This study compared neuronal cell cultures treated with NeuroAiD with cells without NeuroAiD, the control group. Green markers highlight neuronal connections. At day 1, both cell cultures are similar. After 14 days, cells treated with NeuroAiD showed a higher survival rate and are healthier and better connected together, versus the control cells which look increasingly like a desert. This highlights the role of NeuroAiD in stimulating the production of new brain cells, increasing the number of connections between neurons and making them stronger. Clinical trials have also shown patients treated with NeuroAiD within 6 months after their stroke have 2.4 times more chances of reaching independence and achieve a further 25% recovery of motor functions. Since then, many case series and reports have documented improvements on speech and vision in post-stroke or post-traumatic brain injury patients.